started here. Kind of like a new place for me, because I haven't been here in so long, so, I've been out, hopefully with good reasons to be out, all kinds of things happening. Mark says I'm $1 million man. I've had surgeries and teeth implants and everything else, but it hadn't helped. I don't know. I'll find out. Maybe we'll find something that will. And as a matter of fact, I was gonna be here this morning, and, I've got eye surgery planned today, and it was supposed to be this morning. I may get some with me there. Looks like better. And, but they canceled it and put it off till this afternoon, so I'm still, well, I didn't make it this morning, so being dedicated there. There you go. So, but it's good to be back. Have I missed twice or once? One time? All right. But it's good to be back. All right, roll call.
Sam Gibson.
Here.
Charlie Whitaker. Keisha Richards. Cindy Putnam. Zach Gilpin. Bill Fox.
Here.
Chrissy Paley.
Here.
Bill Gibson.
Here.
Ann Stamps. Tracy Long. Here. Alejandra Cisneros Conahan. Michael Burton.
Here.
Chrissy Pike. Barbara Beaver.
Here.
Bob DePriest. Linda Pastrick.
Here.
Marilyn Davis.
Here.
Patty Allen.
Here.
All right, you got a copy of the minutes there. Do we have a motion to approve the minutes from the last meeting?
I motion they be approved.
Motion,
Second.
got a second? We do it off roll or just all?
Roll call or not,
All in favor? Aye. Opposed? Carried. All right, next on the agenda will be Linnell.
All right, thank you. And if you'll look in your CSBG tab, in addition to having your regular dashboards, I put in some other numbers because what I share typically with our policy council and our board are the programs that are run through the county offices, things that maybe touch the community services block grant. But that's not all we do in our department. So if you'll take a look, you'll see that I have information for May and June in that. Of course, you'll see the normal standard dashboards for May and June. Our ERA, the rental program to prevent homelessness, that has ended. We spent all of our money, requested funds from other agencies that couldn't spend, and spent all that money. So we feel that, you know, we got the most amount of money that we could for that program to help the folks here in the Upper Cumberland. You can see that we do a lot of information referrals, that's that last column. And so those are folks calling into our county offices, maybe needing resources for things that we don't have, and where they're very plugged into their counties, they're able to get folks where they need to go. But if you'll take a look at May, this other document, this will talk about some of the other programs that we have. The CSEP program, that is our older worker program, and unfortunately, it is on furlough right now. They're waiting for funds and documents to be released from the federal government. However, they assure us that things seem to be kind of moving on. They're providing us every 2-week updates, and so we're keeping our participants and county offices up to speed. We would love and we hope that everyone's back by September. We don't know that yet, but we're thinking positive and keeping our fingers crossed. We also have a social services block grant, and this is referrals from adult protective services that we provide in-home services to. We also work with our area agency on aging and disability to provide other in-home services, and you can see those different funding types on there with options in Title III. Those are just funding sources for in-home services that we provide. We have our child and adult care food program, and this is where we reimburse if they're serving healthy meals to the children, we can reimburse them. We have a weatherization program. We also have 2 new programs that are transferred over from the area agency to UCHRA. Those are the CREST program and the CREVA. Both of those are working with vulnerable adults, elderly adults that maybe have been victims of crime or self-neglect. So those are 2 new programs that are just getting rolled out that we really, really enjoy working with at UCHRA. The last thing that I wanted to mention on the dashboards, if you don't have any questions, is, we have been talking about our commodities program and how that will be wrapping up in September. So what we're doing, of course, we're continuing on with our distribution events through the month of August and up till September the 20th. September the 20th will be our last event, and it's gonna be a large event. We're gonna hold this in Cookeville at our warehouse, but it's for all 14 counties. So it is gonna be a big undertaking, but we want to get out as much food as possible to everyone. So please take this back, make copies, disseminate this out. We've made it 2 to a page where you can cut that in half, hopefully save on paper. If any of our policy council, would like to volunteer on September the 20th, we would love to have you. You can reach out to Judy Sanchez, myself, or Jordan, and we'll get you plugged in to help us. Does anybody have any questions? Yes,
I will.
Yes.
Will the counties that are scheduled to have distributions in September, will they still have theirs?
So what we'll do, everybody up to September the 20th, if you had a distribution scheduled after that time, we moved those up so that we could give them a distribution. We've gotta have everything wrapped up. So we're gonna take the time from the 20th to the 3rd, to wrap up, get our inventory counted. Our goal is to give out every single food item that we have in the warehouse. So we'll keep going. Like I said, it'll be a large undertaking because we will have 14 counties worth of names and information, but we're gonna make it work.
And have we gotten any feedback from Second Harvest on how they're gonna utilize?
So, yeah, no, we haven't. Mark and I have a meeting next week. It's on Tuesday. Be meeting with the food banks. We'll also be meeting with the Department of Agriculture so that we'll get our official transition plan. So we do hope that after Tuesday, we'll have solid information that we can share. Right now, it's just that one email we received saying that they were gonna switch over to the food banks. But we're very hopeful that we'll have a good plan after Tuesday.
I'm gonna be honest, I was talking in a previous meeting, it's been a little aggravating with the Department of Agriculture, I'm gonna be completely honest. I mean, we have administered this program probably since the creation of it, so 30 to 40 years. Our board chairman has written a letter to the Commissioner of Ag on behalf of the executive board of all the mayors, and that has gone unresponded, they've not responded to that letter. I've made numerous contacts trying through every avenue I've got to reach the commissioner or somebody at that level, and those have been unanswered as well. So I think that they are signaling that they have made their decision, they're not gonna reconsider it. Our hope and prayer is that Second Harvest and the other food banks, which, just to be clear, from what we've understood, Second Harvest of Middle Tennessee will cover 12 of the counties, 11 of the counties. Cumberland and Fentress will be served out of East Tennessee, and Van Buren County will be served out of Chattanooga, and the rest will be served out of Middle Tennessee. So I know they're trying to figure out what they're gonna do and moving forward, so hopefully we'll have better answers come Tuesday, but, it's just been a little frustrating now. I don't know what it's gonna look like. They've gotta figure out if they've got the infrastructure to pick up and continue delivering the same volume of food that we have. Their initial response was they weren't ready for it, so I don't know. So that's as much information that we've been able to receive, so.
I have a question on the signups. Will it also be available that day for those new participants?
Absolutely, yes. So, and with the commodities program, there's a couple of different ways to qualify. If you've received LIHEAP, you're automatically eligible, things like that, but it's a self-attestation, right? So we are not allowed to get verified socials, we're not allowed to verify income or anything like that. It takes about 15 seconds to complete the application, and we will, it does, doesn't it? It's a very short application. And so we will have all of those on hand, and what we're gonna, we've asked our county coordinators to go ahead and look at their list, and maybe even highlight the ones that have not filled out a new application, because applications changed from last year to this year, and so we're asking them to highlight that. But then we'll also have a bunch of paper applications on hand, so that anybody that wants to come through, they'll fill out that. If it appears that they qualify from what they put on that information, they would also be able to go through. Now, These will not be bagged up, we're gonna be giving out cases and different things like that, so if you're telling folks they'll need to make sure that they can get food in their car. Great question, any other questions about, yes?
And can someone still pick up for others? Like, could I come and pick up for my
Yeah,
four
as long, yeah,
people?
you could for that.
Second harvest will be in Bernstown tomorrow.
Tomorrow.
Yeah.
And you know,
Did we get like a day notice, don't we? I mean, that's how second harvest works.
Yeah.
I mean,
We do have it on the board up there, but it's scrolled so fast, some of us have a hard time reading it that fast.
thanks, Dan.
We have so many other things on the board, such as, Stephen and I have got to go back this afternoon, and by the way, I do have, Stephen had to kind of show me the way to cook them back.
County commissioner.
We have a big parade this afternoon. Pickett County has two-time world champion, Bassmaster champions right there in Pickett County.
oh,
High school, Stephen, tell them what those, you know what all those boys want? I mean, we're talking to high school students.
They are, be juniors this year, so they were fishing this tournament as sophomores, so they wanted, it's a nationwide tournament, but they wanted as freshmen and now sophomores. But this year, of course, they win scholarship money to go to college. Of course, they win other things, you know, apparel and this, but they also won a boat. And, so, of course, like, there's two of them, so I don't know how they're gonna split that in half and still float. But they also won, but they have won it back-to-back years. And that's, and it, I mean, there were teams, from Arizona, Michigan,
Canada.
Texas, I mean, it's everywhere. I mean, it's the big Bassmaster high school national tournament. And they're pretty good.
And I think they also won $8,000 each.
I know that, I know the one on the boat won 8,000 because it was a Ranger. I don't know, they may have won 8,000 each, I don't know.
I heard that, yeah, so. But we have a big parade up there this afternoon for those, celebrating that. And, you know, Pickett County, Dale Hollow Lake, you know, we've got the place there to train. And fishing has changed over the time. I'm not a fan of it, but it has. The old time bill fishermen like we would do is in the past. Now, if you don't have the live scope and the right credentials to go out there, you're not gonna compete. I mean, it's got so sophisticated. We have fishing tournaments, we have 2 a year in Bernstown, and Chamberlain and County and I, we all go together and do one in the spring and the fall. And our older group are kinda falling out a little bit because they can't compete with this younger group. I mean, they go out there and it's just like our young kids are with their iPads, you know, they've got their scopes there and, oh, there's a school of fish down there about 30 feet deep and here they are and I'm gonna watch my line go down there. I mean, it's so, it's beyond me. Stay on the bank with my little sinker out there and just sit there and watch, you know, and then, but we have,
The cane poles sit down there.
you know, my mom used to make us do that, you know, sit there. Just back to the good old days, we didn't know. All right, round that, Mark.
All right, Jordan, she's gonna present our community action plan.
Hi everyone, good morning. There is a one-page summary under your CSBG tab of what I'm going to be going into more detail with you about. Now, our community action plan that we submit every year, it is a fairly large document with several attachments, so that's why I've provided a summary. If you request, you can request that. If you would like to see it, just let me know and I can send all of that to you. But today, we are very excited to share how UCHRA is evolving, not just in how we deliver services, but in how we connect with the individuals and families that we serve. Thanks to CSBG funding, we're moving from a model focused on emergency one-time vouchers to a more holistic, person-centered approach that supports long-term stability and self-sufficiency. Historically, CSBG funds have helped us respond to crisis situations, and we feel that's still important. But now we're working to meet individuals where they are and walk alongside them as they set and work toward meaningful goals. So to support this shift, we've pulled in a partner with Volunteer Behavioral Healthcare Systems to provide in-depth training for our staff this September. This training will include assessment, goal setting, service planning, and effective documentation, all of which are critical to the ongoing case management process. Our county teams will be better equipped than ever to provide lasting support to individuals. I want to share a few of those exciting initiatives that are either expanding or launching this year, all of which have been assisted through CSBG funding in one way or another. So the holistic goal setting approach that I just mentioned, we'll be focusing on helping individuals move forward instead of just getting through their crisis situation. And we are training the staff to assist with that goal setting and self-sufficiency planning. And this aligns with DHS's mission to strengthen Tennessee by strengthening Tennesseans. We've also invested in our county coordinators. We've provided them leadership training through local partnerships to ensure that they're empowered and supported. The next thing is poverty simulations and community education. I know we've talked a lot about that here, just the struggles that individuals in poverty face day to day. So we have partnered with some local agencies and HR departments to provide hands-on community poverty simulations to help those local businesses, HR departments, and others who are interested, help them understand the challenges people living in poverty face every day. We are also launching a new home repair program aimed to assist individuals 60 and over with just basic home repairs. So CSBG will assist with those staff salaries to help that program get up and started. We're really excited about it because it's a program Mr. Farley and Linnell have thought about for a long time. We hear our senior population say they don't know who to let in their home, who they can trust, and that sort of thing. So we've already had a lot of good feedback about that, and that will be a fee-based program where we're just doing basic repairs in the home. Very excited.
Let me add just a few things, rather than wait for the end on that.
Yeah.
That is one of those programs that because it is fee-based, because it is something that's not grant-based, so there's no ongoing revenues that cover the expenses of it, we've gotta start small. So I think initially we're looking at Putnam, Overton, and White to begin with, sort of that 111 corridor right there, easy to get to.
And maybe even Overton. Where we gonna
Let's
do?
say Overton, Putnam, yeah,
And Jackson.
Jackson.
Yeah.
Okay.
I knew there was 4.
Short distance, staying fairly centered right there. We're gonna start off with 2 individuals, that have experience in doing that, just the light repair, the handyman type services, because that is something we realize that a lot of our seniors need that assistance with. Now, I will say, my caveat, I've said it every time we talk, this is not grant-based, so we can't do free work, so it'll have to be for the population that can afford, they'd have to pay for those services, so. But that's something we're hoping to see then expand and grow across all 14 counties as we get it solidified here in just 3 or 4 counties, so.
We've had good feedback on it so far, every time we've spoken about it, so I'm very excited about that. And CREST and CREVA program integration, Linnell already kind of touched on that. We have brought those programs to UCHRA from the Development District, because we had similar programs at HRA, and now those staff are able to talk daily about needs within that shared population. So CREST and CREVA, what they do is they help older adults remain independent and secure in their homes. And CREVA, how it's different than CREST, is it focuses on victims of crime or abuse. But both of these programs address critical, often overlooked needs in our region. So CSBG funds are not going to be supporting that program necessarily, but it supports the administrative side of that program. All of these, programs we're talking about today fall under the Community Services Department at UCHRA. And this is one we've already started and seen great success with, and we will continue through with this program. It's the Choices program. It delivers critical in-home services to eligible individuals. It helps address their needs that support their health, safety, and quality of life. So we were able to start that program as well through CSBG assisting with startup costs and salaries for that program. So as you can see, there's a reoccurring theme here. CSBG does not just support one program, it supports all of them. It helps staff our county offices, where our coordinators and support specialists are the first point of contact for individuals coming in for assistance. That can be for transportation, energy assistance, community referrals, and it assists with that administrative support to run programs like LIHEAP and CSEP, that's another one we talked about today, our in-home services, and our newest initiatives. So CSBG is really at the core of everything we do, and it really strengthens the services that we have. It helps us just be able to expand on those existing services and start new ones, like the Choices program and the fee-based home repair program. So I want to transition a little bit to give you an update on our needs as well, because that's a part of our application for CSBG. So our last big needs assessment was completed in 2023, and you all assisted with that, you provided feedback for that. And those top 5 needs in 2023, and that takes about a year to collect all of that data. So we start early, and then, so 22 to 23 is what these needs were. So that was higher paying jobs, access to affordable housing, quality job opportunities, resources for individuals who are homeless, and access to mental health services. So I'm in the process of starting a new assessment, and a lot of times we see the same needs kind of reemerge, and then there are times that we see those needs shift. So one thing that we were very proud of in the past was that, food insecurity fell off of our top 5 needs. You know, we contributed that to a lot of our work with our commodities program. So, I'll be interested in seeing if that rises again, we'll see, I don't know, I hope not. But right now, you all have helped kickstart the efforts with our needs assessment over the last couple of policy council meetings, and I wanted to give you an update on what you all as a group have said are the top 5 needs. So, you've noted childcare and healthcare access, housing affordability and availability, transportation limitations, a lack of higher wage jobs, and an underprepared workforce. Those are the top 5 needs emerging from this group solely. So if you would like to continue to provide feedback to that, please reach out to me. I welcome that at any time. We will be doing another survey that is through SurveyMonkey. We'll have paper copies at our county offices, but we'll also have links that people can get on and answer questions. It's a more in-depth survey than what I gave you all, to just get your first thoughts on the needs of the community. So I just wanted to say we are very appreciative and grateful for your continued support and your feedback. And I feel like our efforts are really helping us build a more resilient community. So like I said, I really appreciate that feedback you provide to us. And again, I will talk about our community action plan. It is a large document, like I said, lots of attachments. So if you need a copy of that, I'll be happy to give that to you, but we do need a vote today on if you approve our efforts here that I've put in front of you as a summary. And I welcome any thoughts.
I would throw one other thing out there, just showing how we're trying to blend programs together. That first point there you mentioned, were staff's being trained to go beyond just crisis response and trying to work with our clients for a plan for long-term success. You know, in our last meeting here, we were able to start touting, because we were getting numbers on our Empower program, that our first batch of families that have come through the Empower program has graduated, and they have seen their income grow by $2.4 million. And that's over a couple of years of working through that program. That didn't happen by just handing them money. In fact, one of the things we're very proud of, you know, we've worked with those, the 68 families are the first batch that's graduated. We've only put on average $2,500 in cash into their pockets that helps them in various things. Everything else has been skills and other types of supports. Through doing that, one of the things we've been doing is trying to create what we call a prosperity journal. In other words, it's a path out of poverty. It's a workbook that families can work through to give them an idea of what that plan needs to look like. So we've got to take and figure out how we market that beyond just the families we're working with through Empower. And that's where we want to see this happen through our county offices as well. So really trying to blend the programs together. So I'm sure Jordan can answer any other questions you might have, or would be open to any suggestions.
Yes.
I have a quick question. So in May, there was one for active client with Alzheimer's, homemaker of it, and it's not in June, so that they exit the program.
Let me get to let me-
Just
yeah.
1 second, we might need some time to get to that.
So I want you right here, one over these. So these are the dashboards. We get these referrals from the AAAD for our options Title III, the Alzheimer's Homemaker Services. So sometimes things can happen. They can either go into a nursing home, they might not need our services anymore. So those are driven by referrals that we receive. Phil actually works with that program with the area agency. Anything that you'd like to add
Well, I would just say that program has actually concluded, so there won't be any more.
on the Alzheimer's? It's been moved to different funding sources.
Yep.
So those funding sources change, and going forward, I could even group those and take the names and just put that under in-home services, because they can shift funding sources depending on what their needs are and where the funds are available.
On your, the fee-based home program, are the contractors that you guys apply, are they gonna be licensed and bonded?
They are gonna be internal employees, so they'll operate under our insurance policies. We're not structured where they would need to be licensed contractors. We're keeping it very basic. It'll include things like yard work or gutter cleaning, maybe some very simple, light switch changes, stuff, nothing that would require any type of licensure.
Leaky faucet, leaky toilet, replacing light, handrails, guardrails, maybe some sheetrock, interior painting, things along that. And then some of them will be case by case, because if we had an agency reach out or something big, then we can look at bigger things. Like I said, we're gonna start with 2 staff, to get this rolling. But everything that we'll be doing, like Mark said, will fall under light electrical, light plumbing, and things like that. But we do hope to grow and expand that program, throughout the years. Great questions. Anybody else have anything over data or our plan? We love them. We love talking about our programs.
And I will just say about the fee-based program, the thing I love about it is CSBG really focuses on gaps in the community. And, that's why we can use that funding to assist with our other programs. And this program, to me, focuses on gaps, because there are so many elderly individuals in the community who may need a simple repair like that, who may not have family members who can come out and do it, but it's too little of a job to call a contractor. I know my husband gets calls all the time for things he can't move from a big house to go and fix somebody's door, you know, so it's things like that. I think that will meet a need and fill in a gap.
And I think as we, get more secure and get this program established and launched, down the road, there's other things that we can look at. For example, being a provider for home modifications through the Choices program, or things like that, that's still gonna touch some of the lower income clients that wouldn't have the funds to pay for this fee-based program. So we think this will just be a launching pad for things that we can do in the community for that 60+ population.
I apologize if you covered this already, but, will it be full fee, or will there be some price break from the provider in return for quantity of referrals?
Yeah, we're gonna defer to Mark on that.
We've got to cover our costs, so it's just gonna be, how do we cover that? We're not looking to make a profit by any means, so we're just trying to cover the basic expenses of the salaries and any supplies that they need, so.
So So we're still working on that, so we haven't determined yet, we're still working on our budget, determine would that be flat fees for certain jobs, or would that be an hourly fee?
Okay.
And so we're still debating on that, we're working to see like exactly how much money, I think we were estimating we needed to do about $300 a day, something like that, to kind of break even, to get us started, but we still haven't got that ironed out, but we want it to be the most cost effective for the client, but also let us, pay those salaries and operating costs, so we can continue to do the program. Hopefully at the next policy council, we'll be able to lay everything out and share, some of our packets and things like that.
Any other thoughts or questions? This has all been great discussion.
I think we do need a motion and a
We
second.
need a motion and a second to approve this community action plan.
I'd make that motion.
Thank you.
Motion and a second. I'm sorry.
No, you're good.
No, we're good.
Okay, you can do
I'm
it.
glad you woke me up. All right, got a motion in a second. Do we need to do a roll call on this, or is it just a short vote? All in favor? Aye. Opposed? Motion carried.
All right. All right, a couple more things. I laid a copy of this at your, place there around the table. This is now this right here is a breakdown. This is done by the United Way, and what they call it's called the Alice Report, and that stands for something. I don't have the exact definition of what that stands for, but it's called the Alice Report. They do one individually for each county, and as we've gone around this summer with our summer strategy sessions, all the mayors, we gave Pickett County yours that was just for Pickett County. I didn't want to print off 14 copies, not knowing who needed what, so I did the state average cost. So I wanted to provide you that, just sort of give you an idea of what we're looking at in Tennessee, because our numbers are fairly close to the numbers here. There's not a lot of difference when you look at county by county. And what this does, the Alice Report, and sometimes you hear it termed living wages. In other words, it's how much does somebody need to make in a community to pay all their bills, to be able to put money back at the end of the month, have a little savings, and have a decent quality of life. And you look right there, in Tennessee, the average for just a single adult, age 18 to 64, is just a hair under $30,000 a year. A single adult, age 65 plus, is closer to $33,000. I'm gonna tell you, there's not a lot of seniors out here with that type of household income. And that points to why you see, and Bill talking about doing the aging programs, our aging population is growing, our waiting lists are growing through our aging programs, and it's only gonna get worse. And then you see the last column there is 2 adults, an infant, and a preschooler, and that's sitting right about 75,000. So you're talking about 2 incomes, almost $40,000 each to be able to survive, and that's in Tennessee. This is what we look at when we're trying to do a lot of different things. And I won't get on the soapbox, but we talk about industrial recruiting a lot of times through with our communities, bringing in outside industries. You do that because they are high-paying jobs. And I told you, your number one need was what? Access to high-paying jobs. I have a saying when we look at our Empower program, you can't save your way out of poverty. That can't happen. You've got to earn more, and we're seeing that happen with these families. It's all about earning more wages and getting that revenue stream increased right there. But I just wanted to share that with you right there. I don't want to go through those numbers. You can look at them, and it gives you an idea of what it costs today for most people, on average, in the state of Tennessee. Just knowing your individual community is pretty close to that. So that's why we're continuing to push this discussion. How do we improve people's quality of life? How do we improve their revenue? And some of these projects are short-term, some of them are long-term. I want to share with you a couple programs. Now, these are not funded programs. These are programs that we are working on actively right now, just to sort of give you a taste of where we're at as an agency, of what we're doing across for the region. The first one I wanna talk about is an application we have made to the Department of Human Services. We'll see, like I said, the application's been submitted, we'll have to wait and see if it is funded. But it's a partnership with the Putnam County School System. Here in Putnam County, they're gonna do something unique this next school year that I don't know has been done anywhere else. And what they're doing is, they've got an old school building here, one that they built a new facility, so they've got an older school building sitting there. They're gonna put all of their pre-K classes in that one facility, or the majority of them. I think they're leaving one in Baxter, maybe some in Monterey, so, but everything generally inside the county is gonna be located, the pre-K program is gonna be located in this one building. And what we're wanting to do is take what we've been doing through Empower and partner with the Putnam County School System to work with those pre-K classes and those pre-K families to try and do what we've done through Empower. You know, I'm gonna be honest, I wanna see how it affects the children. You know, we talk about increasing these families, their wages by $2.4 million. What does that mean for when they go to school? Because theoretically, they're not hungry anymore. Theoretically, they've got a better quality of life. So we're hoping in this partnership to be able to say, the families that we're helping, it translates to the kids in school, that they're doing better. So that's a long-term project we're wanting to look and see if we can do. And hopefully in time, if it really develops here in Putnam County, that's something we can take and offer throughout the other communities. Another partnership that we have, and one that we're getting ready to do a pitch for, and that's coming up in a couple of weeks, Cumberland County, they have a group called TICA. Now, TICA stands for Trauma Informed Community Alliance. That's a handful right there.
That's why we call it TICA.
We call it TICA. So what we're doing there, TICA is a combination of all the different nonprofits and groups in Cumberland County that touch individuals and families who are struggling. Keisha, the Crossville Housing is a part of that. You've been in those meetings, I see you there all the time. So it's a combination of different groups. So what we're doing is we're partnering with that group, and we're making a pitch coming up in a few weeks to a national group that's being funded through the New York Federal Reserve to see if we can become a part of a pilot project to take Cumberland County and implement more on child care. How do we develop not only capacity in child care, but how do we help the child care facilities structure their curriculum where it's really, truly early childhood education, and we're strengthening the families, but we're also making sure those children are getting that foundation, so when they start pre-K or kindergarten, they are where they need to be. So those are two projects. Now, neither one of them are funded. One, we have submitted an application, the other, we're gonna make a pitch to, but we'll see how those things go. I say all that to say this, I hope you see in both those projects, and our Empower project is another perfect one, it's partnership. This agency cannot do the work on its own. It can only get done when we partner with our partner agencies, Tennessee Tech, the hospital, the Highlands Economic Workforce. I say all that to say this, you've got nonprofits like a TICA in your community that we need to be with and be partnered with. So if you've got new initiatives, and I'll open it, if anybody knows of anything new in your community that we may not be aware of, we wanna know about it, and we wanna see if we can partner with them. So anybody got any updates on any new projects or any new groups or anything new that your established nonprofits or churches or whatever are doing in your community that you think we need to know about? Anything exciting? All right, well, you can think about that. If you think of them, you can either send them to us, or you can give us a call and tell us to reach out to them. We'd love to talk to them as well. You know, the TICA, partnership that we have there is a great opportunity where we can take regional help and put it into a community to try and better it.
I can't remember if you guys have partnered with in Quincy.
With what?
In Quincy.
Oh.
They do a lot of different community resources, here,
a contact, you can get, okay, we will do that. Anybody else have anything? All right, any questions on anything we've got going on, any existing programs, any thoughts on those two ideas right there? Yeah.
One that you pitched for pre-K, I know now, parents can't put their kids on the bus, they have to transport them. And if they're all gonna be transported to that one location, are the parents still gonna have to be doing the transportation, or are you looking at transportation for pre-K?
No, we wouldn't get into transporting students, so I'm not sure if they will be doing that or if parents have to drop off, I'm not sure on that.
Would it be through the school system?
Yes, yes.
It is a very centrally located school that may be, you know, it's the old Parkview School right there in the middle of town is where everybody's centrally locating to, but that, you know, that is something we can just make sure that they've thought about transportation.
I'm not sure they're able to transport pre-K.
They don't right now.
Yeah, I don't think.
If you
they're
have 3
allowed.
kids in school and one's pre-K, you've gotta
Yeah.
put some on the bus and you have to drive the other.
Yeah, now, some of the Head Starts, I think are able to transport, I know we do up in Van Buren County, we're able to transport our students, but there may be even a rule, but we'll look into that, Patio.
The good thing with the pre-K program is we feel like that all the families there should qualify for what we're trying to do for any of our grant programs. It's very easy from that standpoint. We can enroll them as they enroll in that program.
Thank you.
Any other thoughts or comments on that? Mr. Chairman, that's all I have.
All right. Do you have any old or new business to bring in? Anything?
I do have old business. Tracy and Alex, I had sent you guys an email with like an overview of the policy council. Once you guys review that, if you could just send me that signed piece of paper back, I would appreciate that. And did we get all of the conflict of interest? Thank you guys so much for the conflict of interest. I know it sounds like we may harass you about those, but we will get a finding from the state. And so we try not to get a finding, so I do apologize that maybe we had to run some folks down through other means, but we are 100% compliant, so thank you, thank you, thank you.
I would just like to share that the county profiles are up on our website now for Tennessee Commission on Children and Youth. So it's very interactive this year, it looks a little different. The page on the data dashboard, it'll list all of the counties, and you can click the little icon to print, and you will receive the printout that we've always done. You know, with the indicators and the ratings, and it's very interactive. Like you can click on a county, and then it pulls up the information, and it will give you last year's rating, ranking, this year's ranking. So there's a lot of information, a lot of good data. There's also some suggestions for improvement, and it highlights some strengths as well. So wanted to share that with you. And I also just jotted down, if you would like to know what the rankings in the Upper Cumberland counties are. This is for children well-being. Overall, Cannon County was 73rd, Clay County was 58th, Cumberland County 42nd, DeKalb County 77th, Jackson County 59th, Macon County 63rd, Overton County 41, Pickett 85, Putnam 31st, Smith 12th, Van Buren 49th, Warren 74th, and White 36th. So for, you know, if you wanted to delve into that information a little bit more, just check out our website.
You might notice in there, and it is in all the economic data. Smith County is the most affluent county we have in the Upper Cumberland. They do best in everything. Yes, Mr. Smith.
I'd like to announce that the food bank will be in Jackson County tomorrow. And it's off of North Mary Street, by the River Baptist Church.
Any other? She's trying to take over, sorry.
No, that's fine. I had been turned off, I don't know why it came on. Any other comments? All right, I think that's it. Do I have a motion to adjourn?
How much we adjourn?
No second? All in favor?